Welcome back. So a key thing we've shown you tonight about COVID and elderly Canadians is that across the board, we expect to see in the coming weeks a broader vaccine rollout in long-term care homes than we have seen to date. But I have a backwards-looking question and I have a forwards-looking question and about 5 minutes to hash it out. So let's bring in Dr. Samir Sinha. He's the Director of Geriatrics at Sinai Health System in Toronto, and Dr. Lenora Saxinger, an infectious diseases specialist from Edmonton. Dr. Sinha, in Ontario, we have this target date of January 21st to finally get around to vaccinating residents in long-term care in 4 regional hotspots, because to date, the focus has overwhelmingly been on healthcare workers in those settings. So here's my hindsight question. Why couldn't we have focused on residents from the beginning? Because we could have, right?
We could have, and the reason why we want to focus on the residents in these settings is because 72% of Ontario's deaths to date have actually been amongst residents in long-term care and retirement home settings. So you absolutely want to go to the people greatest at risk. And at first, Ontario was hesitant to start vaccinating residents because of the Pfizer vaccine and its concern about, using it out in the community, even though Quebec and many jurisdictions around the world were actively doing that. So the focus at first was just about vaccinating staff by bringing them to centers, waiting until we got the Moderna. But the key is we've now had the Pfizer and the Moderna vaccine here, and we have, as of this morning, we had 100,000 doses still sitting in fridges. And frankly, they do nothing when they're in fridges. They do a heck of a lot of good when they're in people's arms. So I'm disappointed right now that we've said by January 21st, we want to vaccinate homes in 4 hotspots. That's only 161 homes, or 25% of Ontario's homes right now, when we have over 200 that are in outbreak right now, right across the province. So we need to actually change our target and say by January 21st, we want every home in Ontario to be vaccinated, period.
Right. What I heard from the ministry today, though, was that the decision to vaccinate healthcare workers first was itself a strategic decision, because in a way they are the gateway of COVID to those people who are most vulnerable. Your thoughts on that?
Well, yes, they are the gateway, and sadly, we've had 9 people die in our long-term care settings who work there out of the 4,000 that have been infected. But let's be very clear that close to 3,000 people in Ontario in these homes have now died of COVID. And so frankly, the target needs to be the residents first and foremost.
Let's compare and contrast. Dr. Saxinger, Alberta has also struggled with outbreaks at long-term care homes, dozens of them in Calgary alone, and accounting for a clear majority of deaths. What is the vaccination plan there, and what do you make of it?
Well, we're just getting more of the details, but in broad strokes, they started vaccinating in long-term care on December 30th, and they also have had the same issue with the Pfizer vaccine, and now the stipulation about not moving the Pfizer vaccine has been lifted, and so there's going to be more flexibility now. And it's my understanding that our stage 1A includes long-term care and designated supportive living homes as well, both of them very important. And that is meant to basically be a major focus in January, as well as select acute care healthcare worker groups.
Right.
And then in February, we hope that we will have had enough long-term care and supportive living people vaccinated that they'll be able to open it up to adults, anyone in the community age 75 and up, which is a very big risk group as well. So it's a pretty ambitious plan, but I think it should be doable.
Right, because it's that February timeline. I mean, when we talk about people who live in sort of group settings, so I'm thinking of retirement homes. Is that where that would fit in?
Yeah, so the designated supportive living homes are the ones where there's a certain amount of support in place, and then the 75 plus who aren't in that category would be earmarked to roll out as long as we have supplies in February. So I think that staging is pretty defensible, and I'm hopeful that we'll be able to actually manage it, honestly.
Dr. Sinha, the other hurdle, if we cast ahead, is this question of vaccine hesitancy. What is your sense of how big an issue that is from staff, but maybe also from residents, potentially?
I'm actually less concerned in our long-term care and retirement home settings. My phone's been ringing off the hook from patients saying, when can I get the vaccine? And we certainly haven't been seeing from our experience of going into local homes that there's been much in the way of resident hesitancy. I know there was a recent report from Windsor Regional, a hospital, where they were saying that locally they were seeing that there was about a 20% hesitancy rate among staff. But what we know in Ontario is that when we do our annual flu vaccination of long-term care staff, about 75% tend to, get the shot, and that's compared to 50% of healthcare workers in general. So, of course, there's going to be some hesitancy. This is not the same thing as being anti-vaccination. This is just, of course, some people saying, I'd like to see my colleague get the vaccine first before I go for it. And we've actually seen already that one of the reasons why staff haven't been getting the vaccine is it's not so convenient to travel far to a hospital to go get the vaccine. But when we bring it on site, people are actually quite willing to roll up their sleeve when we make it convenient for them to do the right thing.
Okay, doctors, I'm afraid we have to leave it there, but this has been very helpful. Thank you so much for your time. I really appreciate that.
Thanks.
Thanks.